The following video is a demonstration of an office shoulder exam. It is performed by Dr. Eric Janssen, board-certified orthopedic surgeon in Huntsville, Alabama.
We're here to demonstrate the examination of the shoulder. The general exam, usually we do about the same way, and then based on the patient's history, we'll do some special tests, which we'll demonstrate later in the talk. To start with, usually we'll go with inspection of the shoulder, which is where we look at it, palpation, which I usually do at the same time, looking for areas of tenderness, and then we'll do the range of motion and strength portion of the test. And once again, based on the history, we'll do any special tests that we think we need to do. So I usually will start from the front of the shoulder, and while I'm palpating the shoulder, we'll look at it and determine if there's any areas of tenderness. So we'll start on the joint line right here, palpate down on the coracoid, then on the joint line down below. We'll then work our way into the biceps area where we palpate along the tendon right along this area on the long head of the biceps tendon, and then start off of the acromion to the AC joint and then work our way down the clavicle to the SC joint. We'll come back, work around the subacromial space down the deltoid where a lot of patients will have some tenderness, and then we'll work on the back of the joint line along this area here. We'll then go and palpate along the trapezius, the medial border of the scapula right here, and then up on the supraclavicular fossa and down below the scapular area down in this region right here. So that will conclude the part where we inspect and palpate. Next we'll do range of motion. For the most part, I'll just do a little quick screen where we'll do a passive range of motion. We just want to make sure that they have all their mobility that's painless. And we'll start by flexing the shoulder all the way up as you see here. Then we'll go back into an abducted external rotated position and into an internal rotated position. Sometimes we'll also want to check when we adduct or adduct the shoulder right there. Then as the last thing, we'll check the strength, and usually we're looking primarily for the rotator cuff, where we'll start by holding the arm straight out, thumbs pointing down to the floor, and that's a good test for the supraspinatus. Have the patient push up while you're resisting against them, and then we'll bring the arms down with the elbows to the side. We'll have them push out, which is a good test for external rotation strength or infraspinatus, and then we'll have them press inward, which is a good test for the subscapularis. And that's basically a real quick general screening exam that I perform in every examination.
For more information on the diagnosis and treatment of shoulder injuries, you may contact Dr. Janssen at SportsMed Orthopedic Surgery and Spine Center, area code 256-881-5151, or go to www.sportsmedalabama.com.